Mhm. We are live. We are live. I'm Dr. Frita, and welcome to another Medical Monday, where we give you all of the hot health topics in the headlines. And as usual, we will not disappoint because there's a whole lot going on in the headlines that we can learn from medically. We'll start off talking about The View. You know The View and Sunny Hostin, our wonderful prosecutor and fabulous activist. Well, she was enjoying a little food segment, and then she had an allergic reaction. Oh, yes. So we'll talk about allergies and anaphylaxis, how it can be life-threatening and what you can do about it. And then we'll get into our weekly dose where I'll give you a fresh take on the health in the headlines that you simply can't get anywhere else. And we'll start off talking about Brad Pitt. You know, y'all all have a favorite Brad Pitt movie. I know you do. Mine is, what is mine? Interview with the Vampire. At any rate, we know that Brad Pitt has had a wonderful career, very well known, highly functional. And he shares that he has actually been struggling with alcohol addiction. And so we will talk about the dangers of alcohol, even in high functioning people with alcohol use disorder. After that, the stories keep going because we're going to talk about hantavirus. What's that? Oh, we talked about it here before. Remember when the actor Gene Hackman was found unalive in his home along with his wife and his dog? Well, we found out that she was diagnosed with hantavirus. We talked about that. And now guess what? That virus is increasing. It's spreading. And so we'll talk about what it is, how to identify it, and Lord help us, how to prevent it. And then, you know, we're going to talk about Diddy, Sean Diddy Combs. That trial, it should be wrapping up. But one thing that's been revealed is all of the health issues associated. We'll talk about some of the alleged victims, how they shared that they had UTIs, urinary tract infections, mouth sores. And so we'll break down what the different implications of UTIs are and what symptoms can also be shared with UTIs. Like, could it really be something else? And then we'll talk about mouth sores, how you get mouth sores and freak offs, and some of the more serious implications of mouth sores. So we got a lot. We'll talk about a lot. So please stick around. Go ahead and give us a like as we get started. I'm Dr. Frita. This is Medical Monday. Welcome, welcome. We are live. I'm Dr. Frita. Let's get this Medical Monday started. You know I'm not going to do it alone. To my co-host, Shador, please come on up to the front of the stage.
Hey, Dr. Frita.
Hey, how are you doing?
Doing pretty good. How are you doing?
Doing well, you know, having some technical IT issues as usual, but thank you so much to everyone who's watching in the chat for your patience. Hello to my replay crew. Hi to my folks on IG, on Facebook. Welcome, welcome. We're about to give you a good show filled with evidence-based medical knowledge. So please go ahead and give us a like as you come in and share. It lets YouTube know we're here. Plus, it lets your loved ones know that they can get some real information. All right. How was your weekend, Shador?
Weekend was pretty calm.
Calm is good.
Ooh, yeah. How about yours?
It was good. It was not calm. It was not calm. I had a really good time. I had a chance to go and spend some time with the family at my uncle's lake house. We were out on his boat. The kids were jet skiing, swimming, talking, loving, laughing. And actually on IG, I did an IG live while I was out there. And I talked about why Black people need sunscreen too, because they want to look at me like I'm crazy just because I'm full of melanin and I have my sunscreen. So check that out on IG Live. I did that on this past Saturday. And then on Sunday, we had a pretty relaxing day for the most part, but it was all good, all good. But I'll tell you what's not good, Shador. The fact that Sunny had an allergic reaction in the middle of The View. And so we're going to talk about allergies and anaphylaxis. And first, I want to know who was the first person in the chat, Shador?
Yes, ma'am. First person today was Miss Pauline.
Hi, Miss Aileen. Welcome,
And
welcome.
Shout out to our member, Miss Andrea, joining us.
Thank you for joining and thank you for being a member. Anyone watching, you too can be a member. And we actually have our members only live today. So go ahead and click the link in the description. Join us and you'll have my undivided attention where we'll just go back and forth and I'll answer your questions live and on stage. All right. So yeah, let's talk some more about Sunny. We're going to play the clip of Sunny and her allergic reaction. And then of course do my favorite little game, myth versus fact. But as we do that, In the chat, I want you all to go ahead and write down what you think some symptoms, some signs and symptoms of someone having an anaphylactic reaction, anaphylaxis, a severe allergic reaction. What are some of the signs and symptoms that someone's having a severe reaction? All right, let's see what Sunny was talking about.
Yeah, on Wednesday's The View, Sunny Hostin was loving the Greek food that former co-host Debbie Matenopoulos had brought in to showcase her new cookbook.
This orzo salad that you're
It's so
eating
good.
is
Chickpeas?
yes, chickpeas, it's tomatoes. This is my Aunt Rula's recipe.
Are there
and
walnuts in here?
there are
I
walnuts.
love that.
Alyssa loved hearing that ingredient. Sunny, not so much, because Sunny has a severe allergy to walnuts. Yeah. Now, on Wednesday's show, you really wouldn't have known something had gone awry. Because, yeah, there's only about 90 seconds left in the segment. Yeah, Sunny wasn't really on camera that much. There's only like 2 shots where you see her again.
Tell everyone what happened to you on the show the other day, Sonny.
You mean when I almost died on the
Yeah,
show?
when you almost died.
On
Okay.
Friday's show, she detailed what we didn't see.
I panic immediately,
Watch the face.
and I write a death note to Alyssa, which basically says, I am allergic to walnuts. And she responds, oh no.
Oh no!
Cheers for Debbie.
So after Whoopi plugged Debbie's book and through the commercial, EMTs moved in.
Our Disney nurses, man, they are like superheroes. They came in, Nurse Jan came in with a cape. She had an EpiPen. She was testing me. I had Benadryl.
They showed a 4-minute commercial, and what I find incredible that Sunny was still there for the next segment. When we see her on camera, she's chugging water, and then the next shot, you can see she looks very, tense. Yeah, if there's ever a reason to step out from the next segment, this would be one.
He was
I
actually
was scared.
All right. So she has a severe allergy to walnuts, but she stayed there and thankfully she did okay. But let's get into these myth versus fact statements, Shador, and let's see what our med heads know about anaphylaxis and allergies.
All right. Statement 1: children with food allergies will outgrow them once they are adults.
Okay. So if you're a child and you have an allergy, if your kid has allergies, they will outgrow them as an adult. Is that a myth or is that a fact? And M1 if you think it's a myth, F1 if you think it's a fact. All right, myth versus fact statement number 2.
Benadryl is enough to stop a severe allergic reaction.
Okay, anytime someone gets a bug bite or they're itching or something, we get a little Benadryl or diphenhydramine. Is Benadryl enough to stop an allergic reaction or an anaphylactic reaction? And M2, if that's a myth, and F2, if that's a fact. All right, pencils down. We'll go over these answers, and then I'll see what you guys said about the signs and symptoms of an anaphylactic reaction. All right, any takers today, Shador?
Yes, absolutely. We always have takers, Dr. Frita. All right. So overwhelmingly, there are saying myth for the first one.
Okay. So if children have allergies, they will outgrow them as an adult. Most people are saying myth. Okay.
Yes. So we have Mr. B16.
Hi, Mr. B16. All right.
Anton.
Hi, Anton. Welcome back.
JS Hill.
JS Hill. You also say it's a myth?
Also say it's a myth. Over on IG, we have Cliff MC saying it's a myth.
Hey there. Welcome from IG. Let's see what I do. So I told you on IG that I did the IG live on Saturday about why Black people need sunscreen too. I also just posted, that's what I did this weekend also. I went to the rap party, Shador, season 3 rap party of the Portia Show. And for those of you who've been following me, you know that I've been on the Portia Show on our Fox 5 Atlanta News several times. She is a brilliant, wonderful, funny, warm, highly intelligent host, and they've been picked up for season 4. And so I've been her guest several times on the show. It's always a pleasure. And so for those of you over on IG, check out, I just posted it last night, the season 3 rap party. It was a good party. And whoever was DJing saved my life. All right. So yes, welcome from IG. All right,
that's freedom.
So I didn't trick anybody. Okay, so yes, that one's a myth. If you're a child with allergies, you will outgrow them as an adult. Now, I put that on there because some children actually do outgrow allergies, but by and large, seriously, the majority, is that most adults do not outgrow allergies that they had as children. And here's the other thing. Even when you are an adult, you can get new allergies, okay? I know I've had patients and we're kind of talking about their food history and they keep having allergic reactions, but then they say, no, I'm not allergic to that because I've been eating it my whole life. Yeah, you can develop new allergies as an adult. All right, so it is a myth. Just because you have an allergy as a child, it does not mean you'll outgrow it as an adult. Most adults do not outgrow the allergies. All right.
All right. Statement 2.
Mm-hmm.
Benadryl is enough to stop a severe allergic reaction.
Oh, I want to know this one.
So we have Maxine says a myth.
Myth. You don't think Benadryl is enough. All right. Hi, Maxine.
Cynthia, hello.
Hi,
Says
welcome.
It is a fact.
You think it's a fact. Benadryl is enough. Okay.
Lisa says a myth.
Hi, Lisa. So you think it's a myth.
Over on IG, Always Vanessa says a fact.
Always Vanessa. You say Benadryl is enough for a severe allergic reaction to stop. Okay.
And DM Lady Di says it's a fact on IG as well.
DM Lady Di says it's a fact. Okay, y'all know I like it when there's a mixed bag because that means that there is an opportunity for teaching and learning, which is what I love. The answer to this one, okay, Benadryl is enough to stop a severe allergic reaction. Drum roll, it's actually a myth. It's actually a myth, but let me explain because I understand, why we have both of the answers. So Benadryl, also known as diphenhydramine, is something that is often enough to stop a mild reaction. Okay. If you have a bug bite and you're itching, if your allergies are really acting up and your eyes are bothering you, your throat is itching you, you take a Benadryl or two, consult with your doctor to find out the proper dose of Benadryl. But when I say severe allergic reaction, I'm talking about anaphylaxis. And that's that severe hypersensitivity reaction where within seconds or certainly minutes, you become you have such a strong allergic reaction to something that your blood pressure can drop. You can have all kinds of symptoms, which we'll get into, and you can ultimately pass away. So while Benadryl might be enough for a mild reaction, when we talk about severe reactions, we're talking about anaphylaxis. It's not enough. I will say that I encourage my patients, if they are starting to have what could be an anaphylactic reaction, if Benadryl is all they have, by all means, take Benadryl. And again, consult with your doctor on what the proper dose is. I consult with my patients, but you want to get something stronger like an EpiPen, okay? An EpiPen, and certainly you want to call 911. So for a severe reaction, Benadryl is not going to be enough. You're going to need a vasoconstrictor, something that tightens up blood vessels very strongly, like an EpiPen, okay? All right. So now let's talk about allergies and anaphylaxis. So an allergy, when you have an allergy to something, your body is reacting to a foreign substance. So typically your immune system is supposed to protect you, right? It reacts to bacteria, to viruses, to other outside germs that are bad for you. But when it's an allergy, you're reacting to something that your body perceives as being bad for you, even when it's not, like peanut butter or broccoli. So your body is telling you that it's bad for you. And so you react and you can get really bad symptoms. So you can get mild symptoms, okay, like maybe a little bit of itching, some hives, but you're breathing fine, some itchy throat, maybe some itchy eyes. But if it becomes a severe reaction or anaphylaxis, you can go into anaphylactic shock. And that's when it can be life-threatening. They reported that Sunny has a severe allergy to walnuts, which lets me know that if she has walnuts and it goes unchecked, she could go into anaphylaxis, okay? So anaphylaxis is a quick or an acute severe allergic reaction that can lead to you being unalive. So did anyone in the chat list any symptoms of anaphylaxis or severe allergies?
Yes, they did.
Okay.
You might have mentioned almost all of them. T Love says throat closing, hives, and
throat closing.
Watering.
And what else?
Throat closing, hives, and eyes watering.
Oh yeah, that's a good bulk of them. So yeah, hives, or you're getting like these rashes breaking out in the skin, throat closing. So certainly your airway can be compromised. So you can get a tight throat. That is severe. That's an emergency. You want to call 911. And if you have an EpiPen, you want to go ahead and take the EpiPen and jab it into your leg, into your outer thigh. Don't be shy. Just do it. Okay. Anyone else?
Yeah. Linda
Hi, Linda.
She says throat swelling and difficulty breathing.
Absolutely. By the time that throat is swelling and that means that your respiratory system is compromised, and there's no time to sit around saying, oh, well, maybe it's something else, or it might be getting better, because truth of the matter, sometimes the anaphylactic reaction can come in waves. And so it might start to get a little bit better, or maybe, you gave someone Benadryl and now the symptoms are getting a touch better. You still call 911, because not only can it get worse again, sometimes even when the reaction seems to have cleared, there's a secondary phase. So don't talk it out and say, oh yeah, it was anaphylaxis, it's getting a little better, we're fine. Call 911 or your local emergency number. Okay.
Sheila says coughing.
Hi, Sheila. So coughing. So definitely, especially for a milder reaction, you can get like an itchy throat and coughing. By the time it gets severe, if that coughing turns to throat tightening, then you're talking about anaphylaxis. Okay.
Yeah, and then one more, Anton, along with the swollen and the itching and swollen face.
That's a good one, Anton. Swollen face. And that's a sign of something that's more severe, like anaphylaxis. So yes. So it might start off where you're getting some itching, some rashes, some hives for anaphylaxis, but very quickly, seconds to minutes, you can get the throat closing, as was mentioned, lip swelling, tongue swelling, swollen face. You can also even your gastrointestinal system, or your stomach, your intestines can be affected as well. And you can get nausea, vomiting, diarrhea. You can get a really weak and fast pulse. Okay. And you can get a blood pressure that drops, hypotension, low blood pressure. All of these are signs and symptoms of anaphylaxis. This is an emergency, and many people pass away within a half an hour. So err on the side of calling 911 or your local emergency. If you know good and well you have a severe allergy, please call your doctor today and get yourself an EpiPen, or consult with your doctor by having an EpiPen, because just having a little Benadryl around the house is not enough if it's actually anaphylaxis.
Right. And Dr. Frita, it can be other things other than the food, right? Brenda.
Absolutely. Thank you.
Brenda said I had an allergic reaction to lisinopril medication, so she had tongue swelling.
Oh, who said that?
Brenda.
Brenda, I'm glad you brought that up. Absolutely. It can be other things other than just food. It can be medications. Lisinopril, or that group of drugs, ACE inhibitors, are notorious for causing that reaction. Now, if you're listening to me and you take lisinopril, no, don't go run and throw it out or say my doctor gave me something that's bad, because by far, most people who take lisinopril do well. It's something that can help to treat early diabetic nephropathy, meaning early kidney disease caused by diabetes. It can help to give you a good heart health, especially if you've ever had a heart attack. It can help with remodeling the heart. So lisinopril in and of itself is not a bad medicine. But when it causes the allergic reaction of angioedema, it can be life-threatening. And that's what you're describing, Brenda. So with angioedema, that's when you take lisinopril and it causes you to have severe tongue swelling, lip swelling, throat closing. It can cause facial swelling. It can make you look disfigured, almost like a caricature of yourself. And it can lead to you passing away. And so even if you've been taking lisinopril for weeks, for years, if you take it and you notice that afterwards you're having some tongue swelling, lip swelling, and that starts to happen, you still can develop an allergy to lisinopril, even if you didn't have one before. That's a 911. And Shador, you remember we had a patient who came in and she was on her way to her daughter's graduation, and she was looking pretty. Why? Because she showed me the pictures. But she developed a severe allergy, and her lips just it seemed like they quadrupled or even more in size, almost like a cartoon. And so that was an angioedema reaction. So again, if you're taking lisinopril, benazepril, ramipril, any of the ACE inhibitors, most people do really great on them, but there's a rare amount of people who can get angioedema. That's an emergency, and that goes on your allergy list, and you need to holler that out every time someone asks you if you have an allergy. Say ACE inhibitors, lisinopril. Okay.
Yeah. And I remember Miss Roslin. Hello.
Hi, Miss Roslin. Thank you for being a member.
She has all symptoms right away when due to a latex allergy.
That's another one. So not just food, not just medicine. Latex is another big one. Y'all throw some other things out here that can cause anaphylactic reactions. So we're talking latex gloves, and we're also talking about latex condoms that people can be allergic to. And again, within seconds and minutes, you can get these symptoms that we've talked about, and it's life-threatening. So if you have a severe reaction to latex, Make sure your doctors know that, because they'll come try to make you better and touch you with latex glove, and they can send you out of here. So that's another good one. Anyone else mention some common things people can be allergic to?
Yes, Miss Linda.
Hi, Miss Linda.
She had anaphylaxis from methotrexate, had been taking it for years.
Oh, you yourself had it. Oh my gosh. Yes. So that's another thing. And almost any medicine can do it. Methotrexate, that's something that can treat rheumatoid arthritis, among other things. And yeah, if you get a reaction, you know it. And that's why it's so important when you fill out the allergy list, make sure it's bold, make sure they got it right, because what you don't want is a doctor to try to help you and then give you a medicine that can end your life and take you out of town. Anyone else?
No one else, but bee stings.
Yes, yes. I was about to say bee stings, fire ants. If you have an allergy, it can certainly lead to anaphylactic shock. And I actually know of someone, a young male, I think he was about 18 years old, and we knew that he had an allergy to bees. He was out and about without an EpiPen, and he got stung by a bee, and in less than an hour, we lost him. Okay. So if you find out that you have a severe allergy, it doesn't mean just buy the EpiPen and have it sit into your house. Okay. It means keep the EpiPen on you. Have one at your workplace, have one in your home, have one in your car, but make sure you follow the directions as far as the temperature to make sure that the EpiPen is kept at the proper temperature and everything. And so it's pretty bad. So I think we listed most of the things. So insects like bees, fire ants, foods, peanuts are a big one. Okay. Having a nut allergy can certainly do it. And what else? Cashews. I was just talking to someone, look, at the rap party. If she happens to be watching, she knows who I'm talking about. I was talking to someone at the Porsche rap party who has a family member with a severe allergic reaction to cashews. And she shared that she was trying to give that person Benadryl in the exact way that it was dosed, instead of just pouring the Benadryl in. Essentially, consult with your doctor about the proper Benadryl dose before calling 911. And now that person has an EpiPen. It's very important. All right.
Blue Crystals chimed in. Hello.
Hi, Blue Crystals.
Blue Crystal says laundry detergents or lotions.
Now you can definitely get reactions to those, because a lot of times when patients come in and they're itching and they don't know it, then yes, I ask, does your laundry detergent have color in it? Does it have fragrance? Are you using a soap with color and fragrance? Are you using lotion with color and fragrance? And if so, those things could make you have, local reactions, or depending on how sensitive your body is, you really could get an anaphylaxis from the things that you use on your skin for cleaning or for laundry. So that's good. Okay.
All right.
I think we hit on most of them. So medications, things that actually touch your skin, like the laundry, certainly different foods like peanuts, cashews. Look, people can be allergic to eggs. They can be allergic to shrimp. Oh, shoot. Yeah, the list goes on and on for food. They can be allergic to broccoli, to tomatoes, things that you might not necessarily think. And so if you do have allergies, that's the other thing. Make sure you let restaurants know, because even if they don't have it on your plate, if they have your food sitting next to something, or if they're cooking it in the same pan that something you're allergic to was in, then that could cause a problem.
Mm-hmm.
All right. Thank you, MedHeads. Thank you for participation. I appreciate it. And so next we'll get ready to move into the weekly dose. But for those of you who are new to the channel, I am Dr. Frita. I'm an MD. I'm a medical doctor. I have been quadruple board certified. So I am a board certified nephrologist, meaning I'm a board certified kidney doctor and high blood pressure doctor. I also have been board certified in internal medicine, pediatrics, and obesity medicine. And so I like to talk a lot about a lot. I read medical journals every single day of the week, no exaggeration. And then I like to come here and talk to you as we have our Medical Mondays. Also, right here on YouTube, we have over 876,000. In fact, I think we have over 877,000 subscribers. I thank you to everyone who subscribes. If you're not a subscriber, please join the party. We have hundreds and hundreds and hundreds of videos here. I give you evidence-based medicine in a way that's easy to understand. So you can watch the videos, you can learn, and you can also advocate for yourself. And so if you know that you're going to see your doctor about gout, check out my video on gout, and it'll give you some really good questions to ask, and it will help the doctor to understand that you are serious about your health. And the squeaky wheel gets the oil. So make sure that you check us out, that you subscribe. And yeah. All right. let's get into our weekly dose. For the weekly dose of medicine, I give you a fresh take on medicine you simply can't get anywhere else. And so we'll open up talking about Brad Pitt. And in the chat, please give me your favorite Brad Pitt movie. Mine is Interview with a Vampire. And Kirsten Dunst, no, she showed out in that movie. And of course, Tom Cruise did. But yeah, give me your favorite Brad Pitt movie. And even if you have not been watching Brad Pitt movies, I don't know where you've been. I know y'all know that he's been labeled as a heartthrob and the most, gorgeous person, as he's come up in his career. And also he really is a very, very talented actor. But he went through a rocky divorce with Angelina Jolie. And he shared that after she filed for divorce, that's when he signed up for AA, Alcoholics Anonymous. And now he's speaking very openly about his high functioning alcohol use disorder. Okay. So let's go ahead and watch that clip. And then y'all tell me about your favorite Brad Pitt movies.
Brad Pitt talking about his journey to sobriety, and Eva is back with that story for us. Hello again, Eva.
Hi again, Robin. Brad Pitt really getting candid, sharing about the moment he knew he needed help and where he went for support.
What's the target? When was the last time you were in Vegas? You want to knock over a casino. 3 casinos?
This morning, superstar Brad Pitt
Can I help you?
opening up about his journey with Alcoholics Anonymous.
I just remember getting my arms around it pretty quickly and really, it became a thing for me. It was really like something I'd look forward to.
Yeah. Me too. That was a very kind of special.
Yeah.
The 61-year-old actor speaking out on the latest episode of the podcast, Armchair Expert, hosted by comedian Dax Shepard alongside Monica Padman. The two say they became friends after meeting in AA.
On my knees. And I was really open I was trying anything and anything anyone threw at me. It was a particular difficult time. I need rebooting.
The Oscar-winning actor has previously spoken up about his struggles with alcohol addiction, revealing in the New York Times he joined AA after his ex-wife Angelina Jolie filed for divorce in 2016.
Yeah. And I'll be honest, as nosy as I am in these social media and media streets, I actually didn't realize that he had been out and talking about having alcohol use disorder. And I'm sorry that he has it. I am happy that he's so open with it and that he shares, because I know that for a lot of people, they think just because they're highly functioning or they have a good job that they can't have a problem, that the disorder is not real. But by him sharing what he's going through, it lets us know that no, you can be high functioning and you can still actually have an issue. So what I want you to do in the chat, and we're going to talk about it, I want you to go ahead and list for me some of the dangers of alcohol overuse. Okay. What are some of the complications for someone who has an excess alcohol use issue or alcohol use disorder? And while you put that in the chat, and I mean everywhere, here on YouTube, on IG, on Facebook, and replay, hey, replay crew, what you do, give us a like and share, please. I want you to go ahead and put what are some of the dangers or complications of alcohol use disorder or overusing alcohol. All right. So first off, let's just talk about alcohol. It's everywhere, right? We know that it's something that if you are on Zoom and people will say, hey, what you drinking? Or if there's always these drinking games, if you watch certain after shows, they'll say, hey, every time you say this word, take a drink. Although I will say they're careful to say don't drink and drive. If you go to birthday parties, there's alcohol. If you go to weddings, there's alcohol. If you go down to the cookout, there's alcohol. Even baby showers have alcohol. It's everywhere, right? It's a part of the socialization. But what is interesting is that according to the CDC, alcohol is actually the leading cause of preventable death in the United States. Okay. A leading cause of preventable death. And a big part of alcohol death is when people binge drink. And by definition, binge drinking is at least 4 drinks at one setting for women and at least 5 drinks at one setting for men. I didn't come up with this gender discrepancy, but those are the definitions according to the CDC. All right, so let's talk about what is a drink, okay? Because if you say a drink, I mean, people have different drinks, different strengths, but there are very definite definitions. So a drink is considered to be 12 ounces of beer or 5 ounces of wine or 1.5 ounces of an 80 proof liquor. Okay. And so just because you go and you have a 16 ounce glass full of Hennessy, that's not one drink. Okay. It's 1.5 ounces. And if you have 3 ounces, 6 ounces, you multiply that out. And that's how many drinks you're having, even if it's in one glass. So that's important to know. Right. And according to the CDC, you're considered to be overusing alcohol if you drink 8 drinks a week or more, and you're a female, born female, or 15 drinks a week or more if you're a man. Again, don't get mad at me about the gender discrepancy. That's the definition as we have it. Okay. And so essentially it's considered to be somewhat mild to moderate use of alcohol if you're a female and you have no more than 1 drink a day on average, a male, no more than 2 drinks a day. And no, you don't get to have override coupons where you're like, I didn't drink all week, so now I could drink 7 drinks on the weekend and I'm good. No, it doesn't go like that. Okay. It's a restart every day. So those are some basic definitions to make sure that you understand. Now, I will say that even though we've had these definitions of what alcohol overuse is, some recent studies have come out and they've shown that even mild to moderate drinkers of alcohol can have an increased risk of cancer and other complications. And so essentially, there is no safe amount of alcohol to drink. So just make sure you have the discussion with your primary care physician if you're someone who uses alcohol and you're concerned that possibly you could be overusing it. All right. Did anyone in the chat give any dangers of alcohol or any samples or examples of complications from alcohol use?
Yes, they did.
Okay.
Simone.
Who is this?
Simone.
Hi, Simone.
Simone says damaged liver.
Absolutely, Simone. So if you overuse alcohol, if you drink excessive alcohol, and what's overused to one person might not be overused to another. There are some people who drink well over what the definition is of alcohol overuse, and some of them don't get liver issues, where we have some people who drink much less or close to that amount and they do get it. So it varies from person to person depending on your genetics and perhaps other medications or things you're using. But yes, alcohol overuse can lead to liver damage. So you can get alcohol-induced hepatitis. You can get liver cancer as well. And certainly you can get cirrhosis, where you get a scarring and a shrinking of the liver that is irreversible. So that's good. Thank you, Simone. Anyone else?
Yes. This is T. Chosen.
Hi, T. Chosen. Welcome back.
T. Chosen says memory loss.
Good.
Cognitive decline.
Good.
Liver damage, and then stroke or heart attack.
Okay, yes. And it's interesting because the memory loss, I don't think a lot of people know that, T. Chosen. Not only can you get memory loss, okay, so in the right when you're drinking, you can get blackouts, right? And then, that next day you see those stories, oh man, I drank so much last night, I don't remember nothing. Okay, so you can get that whole thing as far as memory loss. But there are also studies now, T. Chosen, showing that alcohol overuse can be associated with dementia. Okay, and there's some other things, like some encephalopathies or some pathologies in the brain, Wernicke's encephalopathy, things of that nature. And then you also mentioned heart disease. Alcohol can be associated with something called a dilated cardiomyopathy, where the heart gets really big, and not in a good way, not like you just have a giving big heart. No, physically, literally, your heart can get really big and stretch, and it can even put you at risk for having arrhythmias or abnormal heart rhythms. The alcohol can. And yes, drinking alcohol can put you at high risk for high blood pressure, heart attacks, strokes. So yeah, those are really good. Thank you, T. Chosen.
Chris Cross, hello.
Chris Cross will make you jump. Hey, listen, put a CC in the chat if y'all remember Chris Cross. I'm tired of telling my age on this thing, but okay. Now, what'd you say, Chris Cross?
Chris Cross. So Chris Cross mentioned the cirrhosis and cardiomyopathy, along with that, mood swings, pancreatic disease, and Barrett's esophagus disease.
Oh, good. Okay, so yes, you mentioned which one I talk about. What do I want to talk about first? But okay, let's talk about pancreas. You can get pancreatitis, right? Inflammation, and pancreatitis can actually be life-threatening. So your pancreas is that organ that sits kind of right under your rib cage in the upper center part of your abdomen. It's shaped kind of like a drumstick, okay? Like a turkey leg. And your pancreas is responsible for making all kinds of enzymes that help you with your digestion. Well, if you have excessive alcohol use, you can get inflammation of the pancreas, leading to pancreatitis. It'll make you have no appetite. It can lead to shock or very low blood pressure. And you can even get sepsis or overwhelming infection, septic shock, and you can pass away. And yes, this is from alcohol use. And we see it very commonly in the hospital. And a lot of these patients have to go to the ICU because they really can't pass away from the pancreatitis. And pancreatitis is actually one of those things that can lead to yellow eyes. We're going to talk about Sean Diddy Combs' trial at the end, as I mentioned, and we'll talk about UTIs and mouth sores that were mentioned in the Sean Diddy Combs trial. But also make sure after you finish this live, check out the short form content I've put out on causes of yellow eyes in the Diddy trial, because one of his alleged victims, Jane, said that he had yellow eyes, shaking hands, and gray gums. Okay. But that was a good one. Pancreas. And then Barrett's esophagus. Barrett's esophagus. That's another good one. So what happens with Barrett's esophagus? It happens if you've had reflux or heartburn over time. And it can be associated with excessive alcohol use. So instead of the stomach acid staying in the stomach, we're supposed to, it'll reflux or shoot back up into your esophagus. And the esophagus is the tube that connects your throat to your stomach. Well, the esophagus is not meant to handle all that stomach acid, okay? The tissue that lines the esophagus is not meant to handle it. And so if you, over the years, have a bunch of heartburn associated with alcohol, then it can turn your nice, normal esophagus into something that is precancerous or even cancerous. And so excessive alcohol use can put you at risk for Barrett's esophagus and esophageal cancer of the esophagus. That was a good one. Anyone else with the alcohol issues?
Yes, ma'am. So shout out to our new member, Miss Pauline.
Hi, Miss Eileen.
Pauline.
Hi, welcome. Thank you for being a member. Make sure you click the link as soon as this live is over. We're doing the members only live Q&A, and we'll drop in. You'll have the link, and you can come to the stage, ask us questions. You can ask them just by typing them. You can come do a live chat, but you'll have a full exposure, all of me, and I'll answer your questions. But what did you say, Pauline?
Ms. Pauline says, my brother has cirrhosis of the liver, but he never drinks. Please explain.
Well, things other than just alcohol can lead to cirrhosis of the liver. So, for example, if you have a viral hepatitis, hepatitis A, hepatitis B, hepatitis C, it can lead to cirrhosis of the liver. If there are certain medications that have harmed your liver, minocycline, anabolic steroids, birth control pills. Of course, I'm not talking about your brother specifically. I'm just listing some medications that can cause it. There are some diseases like biliary atresia, primary biliary cirrhosis. My point to you is, just because your brother had cirrhosis, as you've already stated, it doesn't mean that he was a drinker. There are certain autoimmune diseases that can do it. Like you can get an autoimmune hepatitis from lupus, or you might not even know, like he may not even have known that he had an autoimmune disease. And for whatever reason, antibodies can attack the liver. And so there are many things that can cause cirrhosis of the liver other than just having alcohol overuse. Other things that can cause liver disease, NASH, okay? Non-alcoholic steatohepatosis, okay? Like a fatty liver, where if you're a person living with obesity, you can be at a higher risk for it. But the NASH can lead to a liver failure. And what else? There's so many things that can do it. But yeah, just because someone has cirrhosis or yellow eyes, that does not automatically mean that they have alcohol use disorder. Yeah.
All right.
Sorry about your brother.
Alicia says kidney disease.
So yes, so indirectly, the liver's alcohol overuse can lead to kidney disease. When you drink a lot of alcohol, it can be dehydrating, okay, because it blocks that hormone that stops you from using the restroom so much, the antidiuretic hormone. And so you're dehydrating yourself. And then certainly if you develop liver disease, there can be a hepatorenal syndrome, a liver kidney syndrome that can lead to kidney disease. Good.
All right. And before we move on, I remember Miss Roslin.
Hi, Miss Roslin.
She shared that her older sister unfortunately passed away due to alcohol.
I'm sorry. And it just goes to show there's no one face for alcoholism. I know that, like, back when I was growing up in the different sitcoms or even the cartoons, the person who had alcohol use disorder was just slurred speech and unbathed and unkempt. And it was almost like they wrote it like it was a joke, you know, but you can be a high functioning person, good Christian person, and straight up have alcohol use disorder. You can be a millionaire on top of the world. You can be Brad Pitt and still have alcohol use disorder. And so as we get ready to move on, please listen and share this with loved ones, who you think might have an issue. If you're someone who makes your rules about drinking alcohol, like, you know what, I'm not going to drink any alcohol on the weekdays, and I'm only going to have a drink or two on the weekends, and you find that you keep breaking your own rules, you might have an alcohol use disorder. If you're someone who keeps saying, I'm going to cut down, but you don't, think about CAGE, CAGE, CAGE. If you want to cut down, then think about it. You might have an alcohol use disorder. If you get annoyed when people ask you about your alcohol, like, oh, don't you think you had one too many? Or, oh, it's only 10 o'clock in the morning, you drinking. If you get annoyed when people ask you about alcohol, check yourself. You could have an alcohol use disorder. If you feel guilty when you drink, if you're like, oh, I shouldn't be drinking so much. Now, when I'm saying these things, it doesn't automatically mean you have an alcohol use disorder, but put them all together. You think you need to cut down. You're annoyed when people ask you about alcohol. G, you feel guilty. And then E, if you need an eye opener, meaning first thing in the morning, you wake up and you're looking for alcohol. If these things are true for you or for a loved one, it's very, very possible and even likely, especially if you have more than one of these, that you could have an alcohol use disorder. Consult your doctor right away, or consult your mental health provider, and be like Brad Pitt. You don't have to be up on all the talk shows telling your business, but get the support you need so that you don't get these complications we talked about. And I think we covered most of the complications. We talked about liver disease, heart disease, high blood pressure is another one, and certainly what it can do to the brain, causing blackouts, causing memory loss. Make sure that after you finish this live, you watch my YouTube video where I talk about 5 dangers of alcohol, the dark side of alcohol. So when you finish this, just go in the little search bar on YouTube, Dr. Frita alcohol, and I go into more detail on alcohol use disorder. All right, that was good. Thank y'all for participating. I love my med heads and I love Medical Mondays. All right, shall we move on to the next topic?
Yes, ma'am.
This next topic is not fun, but it's important. And so we're going to go ahead and talk about hantavirus. And after this, we're going to talk about Sean Diddy Combs, and we're going to talk about some of the medical implications that we've learned in this trial. Okay, so I want y'all to stay tuned. We already know that Cassie testified that she had UTIs and mouth sores from freak offs. And so we're going to talk about it now. All right, but let's go ahead and play this next clip. Now, you'll recall that Gene Hackman, okay, he was found down with his wife and his dog, and she had hantavirus. So let's talk about that because it's on the rise.
Health experts say several cases of hantavirus happen every year here in our state and are reported to the Centers for Disease Control. We spoke to the University of New Mexico's top doctor who specializes in respiratory viruses, including hantavirus. It's a virus that is most commonly found in rodents and can be passed to humans through their droppings, especially if it is inhaled during a cleanup. It can cause fever, muscle aches, and respiratory problems before becoming fatal.
Some people recover and don't go into that next more dangerous phase, the cardiopulmonary phase. That phase, patients start to cough. They have capillary leak. So the capillaries, the small blood vessels in the lungs, start to leak fluid. So your lungs fill up with fluid. You develop fluid around the lungs.
The Centers for Disease Control says the mortality rate for hantavirus is up to 40%. Harkin says it is best to avoid rodent droppings, but added it's important to wear protective gear and thoroughly disinfect an area before cleaning it up.
Absolutely. That's very scary. And you remember how mysterious that was with Gene Hackman? You know, he is an Academy Award winning actor. Lex Luthor was my favorite role that he played. And he was, in his 90s, I think he was 96, and he was found unalive along with his wife. His wife was younger than he. I think she was in her 60s, and their dog. And it was such an odd thing. Their poor dog was in his crate because he had a surgical procedure. And so that poor thing, had he been out of the crate, then maybe he would have been able to bark and make a fit and tell a neighbor. At any rate, they ultimately found that his wife had hantavirus. And as they just stated, that's a virus that's found in rodents. In the United States, it's usually found in the deer mouse. And it's very rare that hantavirus is passed from human to human. I've actually never seen a case or heard of a case. It's almost always passed from inhaling the virus from rodent droppings, rodent urine, rodent saliva. Okay. So rat feces, rat saliva. And again, the deer mouse is the most common. There's some other ones that can do it. The white-footed mouse, the cotton mouse, the rice rat. There's some other mice that can do it as well. The thing is, the way that it presents is that you might just get flu-like symptoms, but then after a couple of weeks, those symptoms can become very severe and they can lead to the respiratory or breathing problems from the leaky vessels in the lungs, as was described in the clip. And so the real take-home message for all of my med heads, everyone watching, is that if you're someone who's going into a high-risk place, like going to clean out an old unused property, okay? Look, take your mask, take your gloves, but again, disinfect beforehand. If you're going and you're cleaning out a shed that hasn't been used very much, if you're going and cleaning out the garage, somewhere where mice may be, then it's possible to have hantavirus. In the United States, most of the cases are to the west of the Mississippi River, okay, like in California, things of that nature. And I believe it's only really in North America and South America and Central America, the hantavirus, as far as where it's been found. Here's the key. As they mentioned, the mortality rate, or the people who die, 40%. Okay. So 4 out of 10 people who get hantavirus will die. And we don't have a good treatment. It's just supportive care, like oxygen, IV fluids, a breathing tube if necessary. And so you really want to prevent it. And the way to prevent it, first, you have to have the knowledge and know that it exists. Okay. All right, let's get into the Diddy of it all, shall we, Shador? Y'all, please make sure you give us a like and a share, and you subscribe and you follow, because we're giving you evidence-based information over here. All right, so we've had the Sean Diddy Combs trial, and so much has come out. So much has come out. And I know that for those of you who've been watching me, or if you've been anywhere except for under a rock, you know what's going on with the Sean Diddy trial. He's been accused of sex trafficking, of RICO, of all of these things. And we know that he had freak-offs, which is when there were big groups, like orgies, of people having intimate situations. But what they're saying, the alleged victims, is that they were forced to be in these situations, including Cassie, his ex-girlfriend, or was she someone who was an enslaved sex person? That's what's up for discussion as they get ready to come to the close of this case. Well, let's listen to what Cassie testified as far as medical issues she had from the freak-offs.
Sean Diddy Combs' ex, Cassie Ventura, details the physical pain she endured as part of his alleged sex parties. During his federal sex trafficking trial May 14th, Ventura, who had an on-and-off relationship with the mogul from 2007 to 2018, testified that Combs instructed her to have sex with male escorts during his alleged freak-off events, even when she was hurting. She said for NBC News, which had a reporter in the New York courtroom, "When we were having frequent freak-offs, they were back-to-back. And sometimes I would do a freak-off with the infection. I tried to flush it out with water. I got to the point where Cipro, the antibiotic ciprofloxacin, didn't work anymore. It was a mess." According to the singer, in addition to urinary tract infections, UTIs, freak-offs would cause mouth sores from having oral sex with lubricant repeatedly, and gastrointestinal issues. She said for NBC News, "It was really painful for a long time. I can't believe I actually dealt with that." The 38-year-old, who is pregnant with her and husband Alex Vine's third baby, added, "Having sex with a UTI was horrible, so uncomfortable. I would not advise it."
That is horrible. She had to sit up there pregnant. And of course, she's had that third baby now. Cassie has, but she was pregnant when she testified, and she had to sit up there in front of everyone and reveal all of her business, the intimate details of the professional love workers, the prostitutes who they had. And I'm talking about male prostitutes who came in, how she had to perform with them in front of Diddy. This is what she has testified. We'll call it alleged. And how even when she wanted to leave, even when she had urinary tract infections, even when she had mouth sores, according to Cassie, he still made her perform in the freak-offs. And so we're going to talk about UTIs, okay, urinary tract infections, and mouth sores from freak-offs. But what I want you to do, please, in the chat, I want you to put symptoms of UTIs. And then I also want you to tell me what other kind of diseases might have similar symptoms to UTIs, or urinary tract infections, bladder infections. Okay, so put that in the chat, please. And then, so urinary tract infection, that is, as the name implies, an infection of the urinary tract. And so, Shador, if we could put up that slide on the urinary tract system, what it looks like, it consists of your kidneys, your ureters, which are the tubes that connect the kidneys to the bladder. You see that? Your two nice little bean-shaped kidneys. And then the ureters, those are the tubes that connect the kidneys to the bladder. And then you have the bladder. And then leaving from the bladder is your urethra. That's a tube that leads from the bladder to the outside world. Now you can imagine if you are a man, your urethra has to go all the way through the male organ. And so you will have a long urethra. If you are a woman, then your urethra is short, right? Because the distance between the bladder and the outside world is short. You don't have that long male organ. This is significant when it comes to urinary tract infections because women by far get more urinary tract infections, UTIs, than men. Why? Because the bacteria are able to go through that urethra, that tube that connects the bladder to the outside world, and they can get up to the bladder pretty quickly. Okay, it's a short distance, and they can cause a cystitis or a bladder infection. For men, by the time the bacteria start crawling through the urethra and going up the length of the male organ, a lot of times the men will urinate, and then the bacteria are like, London Bridge is falling down or Jack and Jill roll down the hill. They don't get a chance to get up. With that being said, that's why women get UTIs so much more often than men. And in fact, 60%, 6 out of 10 women will have a UTI in a lifetime as compared to just 5 men out of every 10,000 men. Can you imagine that discrepancy? But yeah, it's mainly because of the anatomy. And of the women who get UTIs, about 1 in 4 will get a repeat UTI. So that's the story on the UTI. And some things that can cause it, bacteria mainly like E. coli, Klebsiella, Proteus. There's different bacteria that can cause it. Yes, it can be caused by, you can get a fungus infection or viral infection, but by far bacterial UTIs are the most common. Some ways to prevent UTIs, making sure you have good hygiene, of course, in general. And for women, wiping from front to back. You don't want to pull from the back and get anything that's around the anus by your urethra, by that urine hole. You want to wipe from front to back. And very importantly, you want to prevent getting honeymoon cystitis. What's that? You tell me. Anyone who knows what honeymoon cystitis is, put it in the chat and put HC in capital letters so we can see you're talking about honeymoon cystitis. And I'll revisit. Now, so the urinary tract infection symptoms, anyone put any of those?
Yes, they did.
All right. What are some of the symptoms?
DH. Hello.
Hi, DH. What is that?
Painful urination and bleeding.
Painful urination and bleeding. Yes, you can get painful urination, also called dysuria, and you can even get spots of blood in your urine. Absolutely. Good.
T chosen.
Hi, T chosen.
Says fever and bladder pain.
Yes. So if you have cystitis or inflammation of the bladder, a urinary tract infection, yes, it can lead to a fever for sure. And it can be painful when you urinate and have contractions in the bladder and all of that. Very good.
Ms. VE is joining us today.
Hi, Ms. VE.
She says burning sensation, feel of bladder not empty, and fatigue and pain.
That's a good one. Yes. All of those are correct. So that burning sensation or pain when you pee, the dysuria, and the feeling of not being empty. That's a very important one because you might go, you urinate, and you still have a sense of bladder fullness. Okay. And yeah, certainly you can get fatigue, you can get fever, especially, if you recall that photo, if the infection goes up, not just from your bladder, but if it creeps on up and it's in your kidneys, then you can get what we call pyelonephritis or kidney infection. And that can really cause you fever and even sepsis, and you can even be unalive. Okay. So yeah, those bacteria will crawl up. They'll be in the bladder. You see that little inflamed little red bladder over there? Ooh, it's angry. And so you can get bacteria there, but yes, they can climb up into your kidneys. You can get kidney infection or pyelonephritis, and you can even get septic shock. And yes, you can pass away. And one thing that's interesting, a lot of older people, elderly people, people over the age of 65, listen, that's what they call elderly. Now, if you're over 65 and you're listening to me, I'm not calling you old, okay? But people who are older will oftentimes get UTIs that don't have those obvious symptoms. But if you have someone who's older and they get confused, fatigued, stop eating, I don't care if they don't say anything about burning urine. You always want to take them to the doctor, mention UTI so they can check it. Okay. So anyone else about the symptoms?
Yes.
Okay.
Joyously hopeful.
Oh, joyously hopeful. Me too. I'm joyously hopeful. Welcome. What do you say?
Irritation, odor with urinating.
Oh, thank you. So in addition to that irritation, you can get foul smelling urine. Absolutely. It can be dark, it can be cloudy, and it can be foul smelling. Okay. Pay attention to your body, everything that happens, everything that comes out of it. You know how it normally smells when you're in the restroom. If your urine is giving off some other odor, check and see if you have a UTI. But certainly with the frequent freak offs that Cassie was having, you know, and that they've talked about in the Sean Diddy Combs trial with so many different men, and especially he requested that the men have BBDs. Ooh, I don't want my algorithm to be thrown off. Basically, Diddy requested that she hire the professional sex workers. He wanted them to have very large male organs, and allegedly, or the way that they testified, or she testified, he wanted to watch her be with these men with very large organs. So you can imagine if she's with a bunch of men, even in the same night, same freak off with big organs, and then now she's getting their bacteria on her, and you're sitting in it. That bacteria could very well be the reason that she had the frequent urinary tract infections, right? But there are other things that can cause burning, foul odor, pain during intercourse, other than just urinary tract infections. Did anyone pop in, or do you want to pop in now and say what other kinds of diseases could cause similar symptoms to the ones Cassie described?
No one popped in with it.
Okay.
Yes.
Well, STIs can certainly do it, right? Okay, sexually transmitted infections can do it. And so now I'm not saying that Cassie had this. She's not testifying to it. I'm not saying that. I'm just want to present a full circle. The pain during urination, foul odor, pain with intercourse can be caused by things like chlamydia, gonorrhea, trichomonas. Okay. And so for people who are at home and they're going to take some over-the-counter azo and they're like, oh, yeah, it's just a UTI. Make sure you go get it checked out, and make sure you don't have an STI, also formerly known as STDs. Make sure you don't have a sexually transmitted infection as well. Because certainly if you're in freak offs and you're with multiple partners, oftentimes unprotected, that's how it was testified, then certainly you would be at high risk for an STI. Okay. And then she talked about mouth sores as well. And she said it was from the oral intimacy, that she would have mouth sores and he would still make her do the freak offs. I want to know if anyone in the chat knows what, how do I want to ask this? What STI, okay, or sexually transmitted infection can cause mouth sores? We'll get into that because there's more than one that can cause mouth sores. But specifically, I want to know what STI was studied in what is deemed to be one of the, if not the most unethical studies in the history of our country. A study that started in 1932, where the men in the studies were Black men, mostly poor sharecroppers from Macon, Alabama. And they had this specific STI. And even once the scientists in the study, and this was a government sanctioned study, even once a cure for this STI became available in 1947, these Black men were not told about the cure, and they were studied as if they were lab rats until the whistle was finally blown in the 1970s. Do you know what infection this was in this unethical experiment and the name of the unethical experiment? Any answer you know, you can throw it in there.
Ms. VE threw in syphilis, her and DH.
Who said that? Good. DH and who else?
VE.
Exactly. I'm talking about syphilis. And what's the study I'm talking about? The experiment I'm talking about?
She says V, circle back, Tuskegee study.
The Tuskegee experiment. Okay. One of the most unethical, if not the most unethical stories in history. And when you go back and you look at some of the documentaries, and the men, they were just smiling and happy, and all these good, governmental officials, these nice white scientists were coming down to this little small town to see about them. They really felt seen and felt important, like they were really helping in science, who knew that they were being just treated in such an unethical fashion. So this is why I'm mentioning the syphilis. So yes, you can certainly get mouth sores from the friction of all of the frequent oral intimacy that Cassie testified to having, but also syphilis can present usually on the genitals. Stage 1 syphilis, there is a painless chancre, okay? So it's a sore with the raised border, but you can get syphilis through any contact, any sexual contact. So whether it's through genitals or oral intimacy. And if you get syphilis from oral intimacy, then you can get a chancre and it can cause a mouth sore. No, I'm not saying that's what happened with Cassie, but I'm just saying that mouth sores are not just from friction necessarily. You can get STIs that cause a mouth sore, like syphilis. In fact, another one of Diddy's ex-girlfriends, Jane, testified that she had some issues with him. Let's play that clip, that second clip with Jane.
about contracting a UTI and a yeast infection because of these hotel nights. In a few exchanges, she wrote, "You are the threat to my health and my sanity." And then she also said she regrets everything. Jane back on the stand today for a third day, and it was very emotional. She testified about Diddy being physically violent with her. She claims that he choked her, that he broke down door frames, both a closet, a bathroom door, a bedroom door, and that he even lifted her up by her neck. Now, she does not have any photo or video evidence to support this, and she never went to authorities because she said that she was too scared to tell anyone. She also testified about telling Diddy multiple times that she did not want to participate in those drug-fueled sexual encounters with male escorts, which she called hotel nights, and several exchanges she read on the stand, one in which, quote, "It's been 3 years of me having to have sex with strangers. My spirit and soul are tired." In another text exchange, she said, "I feel violated and manipulated by you." Jane also testified about seeing Cassie's lawsuit for the first time in November 2023, and she said, "I almost fainted. In fact, I think I did, because there were 3 specific pages that were a harrowing resemblance to what I went through." In another text exchange, she told Diddy that she knew that she was consenting to these hotel nights, but when prosecutor Maureen Comey asked her today if she actually was consenting, she said, "I'm still trying to figure that out." Jane is expected to be on the stand throughout the rest.
Yeah, there's really something. It's tricky. And I think what a lot of people aren't getting with these cases. So you hear her clearly talking about the infection. So she had UTIs and then she had yeast infections. And there can be a connection. So yes, with UTIs, those are typically bacterial. Yeast is a fungus, okay, usually Candida. If you are taking antibiotics to get rid of a UTI, well, it can change the flora or the natural bacteria that are in the vagina, and it can lead you to having a yeast infection once those are thrown off by the antibiotics. So there can be certainly a connection there. But the thing is, a lot of people are like, well, they consented. They wanted to do the freak offs. They were writing dirty text messages. Once you get into an abusive relationship, and I'm talking in general, I'm not saying Sean Diddy did it. I'm just going to say alleged, although it's not alleged with the physical abuse, because we saw that on that tape that CNN got. Okay. And then he dragged her back into the freak off. How can you say someone's consenting to a freak off when they're trying to escape like Cassie did? And then we see her get base thrown at her, kicked while she's down and dragged back in it. But anyway, a lot of people do actually love or think they love their abusers and will oftentimes consent to keep the abuser happy, to cut back on having, the physical abuse that Cassie described. And so it's not black and white. And so when I hear people saying, they was just fast, they just wanted it, they just wanted the money, it's a complex situation. And, someone having the UTIs, trying to run away, getting choked, all of those things is certainly not black and white. And the cycle of abuse can have the person who's abused be very confused and not know and go in and out. That's just what it is. That's just a psychological fact. But that's just an overview of some UTIs, mouth sores, and some other STIs that can cause mouth sores. Herpes can certainly do it, where the virus causes fluid-filled blisters on the mouth. And you can get not so much mouth sores from gonorrhea, but you can get a sore throat that looks like maybe it's strep throat, but it can be pus on your throat from gonorrhea. And so just a reminder. And with syphilis, that's something that, unlike hantavirus, we do have a treatment, penicillin. After all these years, syphilis is not that smart because it hasn't, done a mutation. I'm not asking for it to do a mutation, but penicillin still will treat the syphilis. And syphilis has been on the rise. At one point, yes, we thought that just the highest risk factor was MSM, men having sex with men. But also in cisgender people in heterosexual relationships, syphilis has been on the rise. So please don't think that just because you are in cisgender heterosexual relationships that you're not at risk. Syphilis, at least since 2001, according to the CDC, has been on the rise. And so with that, I'll see if we have any quick questions before we go to our members only live Q&A. In fact, y'all, just join the membership and come on and join us over there. Make sure you give us a like before we close this thing out, and give us a follow and a subscribe. And, I'll take a couple of quick comments before we slide out of the door, especially from our members. But just remember, we're here every Monday, Medical Monday, giving you evidence-based information. And, I am, as I mentioned, a board certified kidney and high blood pressure doctor. I've written a book Under Pressure, A Guide to Controlling High Blood Pressure. You can click the link in the description here for that book, or you can go to my one-stop shop, drfrita.com, where you can get that book. You can also check out my favorite things, like some blood pressure cuffs that I find to be useful, that have been validated and that are good. And also some of the exercise bands that I like, and I'll be putting up some of the different little exercise equipment that I like to use, the yoga mat. So stay tuned. All of that's on my website, drfrita.com, my favorite things. And of course, I enjoy talking to y'all here on Medical Mondays. But if you want to have a conversation with me one-on-one, I do have a concierge service, okay, where I can talk to you from anywhere in the world. Yes, we can do a video call from anywhere in the world. And I take the time, we do a full history. And so if you have questions, like if you want a second opinion about what you and your doctor discuss, or even a first opinion, you want to talk about kidney disease, high blood pressure, or anything, okay, just let me know. As I mentioned, I read every day. I've been board certified in 4 different specialties. And so I've been having some really good success with this telehealth concierge service. Click the link in the description, or again, visit my one-stop shop, drfrita.com. All right, as we get ready to slide to the left, Shadori, any comments or any musties that you?
Yes, I do have one question.
Okay.
This is from Sheila.
Sheila, hi Sheila.
She says, my husband has to wash his hands constantly at work and his hands get an allergic reaction. What can he do?
Oh, geez. That's tricky, because I actually had a similar thing happen to a family member of mine, but with her, it was the Purell, okay? Or I shouldn't say Purell. It was hand sanitizer, and she found out she had an allergic reaction, and her skin got really dry and crusty, almost like a lizard scale. So if he has to wash his hands frequently at work, there's a few things. One, he might need to take his own soap and make sure that it's a hypoallergenic soap. Hypoallergenic soaps, meaning like they have no fragrance, no color. Those oftentimes are more expensive than some of the less expensive soaps that they use in hospitals. And so he may need to just literally take his own little dispenser of soap to make sure it's not the soap he's allergic to. And then also, you want to find out if it really is an allergic reaction, or is it dry skin. If it's very dry skin in reaction to being dried out from the soaps, then he may want to take a nice hypoallergenic moisturizer, like a Eucerin, a CeraVe, one of these lotions that has no color, that has no fragrance, and make sure that he keeps his hands moisturized between washing them. The other thing is, depending on what he does, instead of touching things directly with his hands, he might want to make sure that he's wearing gloves. And so, of course, he's still going to wash his hands, but it may decrease the frequency if he's using gloves instead of his bare hands. But first and foremost, have him to consult with his doctor, his primary doctor. And if it really is an allergy, or you're suspicious of that, ask about seeing an allergist. Okay, I wish him really good luck, and thank you for joining us.
All right. Thank you, Dr. Frita.
All right. Thank you to my wonderful co-host, for all of my members, all the members. Okay. Y'all saw how Beyonce had that faux pas that happened at her concert, where the thing that was hanging over. Anyway, I won't get into Beyonce right now. I love Beyonce. All right. But for all of my members, please come on. We're about to head over to the members only live Q&A. Get your questions ready. Here we go. Thank you for joining, everyone. Thank you to my co-host, Shador. Thank you to everyone on YouTube, on IG, on Facebook. Hello. Thank you to my replay members. And thank you for making Monday your healthiest day of the week.